Yes, today let's take a look at your Heterophyes. And yes, your Heterophyes, this one is one of the most smallest trematodes to infect humans. And yes, human infection is acquired through the ingestion of pickled or uncooked fish or salted fish. Okay, and yes, please note also that aside from humans, your Heterophyes are also capable of infecting or parasitizing birds and mammals. Okay, and so yes, please note that. Okay, and so in the infection with the heterophyes was first reported by Bill Hars accordingly. Okay, yes, let's heterophyes is otherwise known as your von Siebold's fluke. Okay, and so von Siebold's fluke. Okay, and so this one is also otherwise known as dwarf intestinal fluke. And yes, again, this one is the smallest fluke of man. This one is smaller than Metagonimus yokogawai. Okay, and so humans accordingly again become infected by ingestion of parasitized fish that is raw. Okay, as for the mode of transmission. Okay, ingestion of the second intermediate host of ingestion of raw fish containing the metacercaria. Okay, and so this one is a teardrop shaped fluke. The habitat is the small intestine. Okay, and the first intermediate host are snails. Okay, and yes, or your blackish water snails of the genus Pyrenelia and Ceritidea. And the second intermediate host are fish. Okay, and so you have your fish, mugil or mullet and yellow perch accordingly. Okay, and so the infective stage are metacercaria. Mode of transmission, ingestion of the second intermediate host. The definitive host is man. Okay, and so please note in this case, metacercaria can survive for up to 7 days in salted fish. Okay, and so metacercaria can survive for up to 7 days in salted fish. Okay, the ova, let's take a look at the developmental stages. The ova of your heterophyes is operculated and mature when laid. It measures 27 to 30 micrometers by 15 to 17 micrometers. Okay, and yes, it is light brown and has a thick shell. And yes, it resembles your Clonorchis sinensis ova. Your Clonorchis sinensis ova resembles an old-fashioned light bulb. Old-fashioned light bulb or old-fashioned electric bulb. Same with Heterophyes. Heterophyes, it has also an old-fashioned electric bulb structure. Okay, and so as for the adult heterophyes has a cuticle that is covered with a small scale-like spine. Okay, and so it is covered with small scale-like spine. The testis is ovoid and placed side by side, which is located in the posterior fifth of the body. The ovary is globular and the vitellaria has large polygonal follicle in the lateral posterior third of the body. Okay, yes, please note that the it measures 1 to 1.7 millimeters by 0.3 to 0.4 millimeters. Okay, and so yes, it has an oral sucker and a ventral sucker. In addition to that, it has the third sucker, which is known as the genital sucker that surrounds the genital 4. Okay, that is for your heterophyes. Please note again, this one is smaller, 1.0 to 1.7 millimeters by 0.3 to 0.4 millimeters, comparing it with Metagonimus yokogawai. Okay, for your heterophyes. Okay, and so yes, okay, and so please note that the testes, okay, are large and paired and they are situated in the small ovary. Okay, the surface of the worm is covered with small spines. And yes, you have here your oral sucker. Okay, and so you have the pharynx. and the rest. Okay, and so yes for this one. Okay, and so moving on, let's take a look at the life cycle of your heterophyes. Okay, the adults reside in the small intestines, and yes, embryonated eggs are passed in the feces. Okay, and so for your heterophyes, okay, the ova is embryonated. Okay, embryonated are passed in the feces, and the embryonated egg is ingested by the first intermediate host, which are snails of the genera Cerithidia and Pyronilia. Okay, and inside the intermediate host, miracidium is released, and the miracidium develops into sporocyst, into rhidia, and then to cercaria. Okay, after that, cercaria are released from the snail, and then your cercaria will insist in the second intermediate host, which are fresh or brackish water fish. Okay, and so they insist in the second intermediate host. Okay, and yes, humans are infected by ingesting undercooked or salted fish or pickled fish containing the metacercaria. Again, please note that in salted fish or salting, larva metacercaria can survive up to 7 days in salted fish. Okay? Yes, inside the host, the metacercaria will exist and attach to the mucosa of the small intestine, which wherein it will mature, of course. Okay? As for the life cycle, still you have here the what you call this, the adult resides in the small intestines, and it passes or it produces or yes it lays embryonated or mature eggs, and then yes again so your miracidium or the snail host ingests your eggs, and inside the snail the miracidium is released, and then it will develop into sporocyst, then to rhidia, then to cercaria, and the cercaria will move outside of the snail, and then the snail will again so penetrate the skin of your fresh or brackish fish again so or into the scales of the fish, and then yes the human host again so become infected upon ingesting undercooked fish containing the metacercaria. Okay, and the cycle continues. Okay. Yes, for the pathology and symptoms of your heterophyes, following the ingestion of metacercaria, please note that the pre-patent period is approximately 9 days. The pre-patent period is, this one is the pre-patent period in parasitology is the time between the parasite's initial infection and the point where its infective forms can be detected in the body. Okay, yes, the adult worms, please note that the adult worms cause little damage to the intestinal tract mucosa except for mild inflammatory reactions. In heavy infections, the worms will cause abdominal pain, mucus diarrhea, and ulceration of the intestinal wall. Okay, please note that adults may attach itself deeply in the intestinal wall, and some of the eggs may end up in the general circulation of the host. Please note that the adult heterophyes is very small. Okay, and so it is very small. Also, the size of the eggs are small, and yes, the eggs may end up in the general circulation. Okay, and so with that, the small eggs may provoke pathologic lesions, particularly in the heart and in the brain accordingly. Okay, and so for this, please note that there in the Philippines there are reported cases of fatal heart disease that are results of heterophyid myocarditis. Also, neurologic manifestations are also seen due to adult worms or eggs in the brain has been reported. As for the laboratory, again, so still fecalysis, eggs in the stool, demonstration of eggs in the stool. Still, eggs are found in the stool, and rarely adult worms are found in patients with heavy infections and or after therapy or at autopsy. Okay, and so please note that the eggs of Heterophyes, Metagonimus yokogawai, and Clunorchis sinensis appear almost identical and are very difficult to differentiate from one another. Okay, and so yes, your FECT, your formalin ethyl acetate sedimentation concentration technique is the recommended procedure for the egg recovery. And yes, again, please note that operculated eggs do not float in the zinc sulfate flotation concentration method due again to the presence of the operculum making it heavy. Okay, still again, so the eggs have very inconspicuous opercular shoulders, unlike Clonarchis sinensis that lack the seated operculum and knob at the opercular end. Okay, and so your heterophyes ova is one, okay, of the smallest trematode eggs that are seen and maybe miss out using your low power objective. Okay, since you have Heterophyes, the ova of Heterophyes are similar in shape and size to those of Metagonimus yukugawai and Clonarchis sinensis, differentiation accordingly should be supported on by the patient's history, clinical findings, and of course, recovery of adult worms in the stool. As for the treatment, praziquantel is still the drug of choice for heterophyes infection. Okay, and prevention and control. Thorough cooking of fish still, or do not eat. Okay, and so uncooked fish. Okay, sanitary waste disposal and educational information about proper sewage disposal away from ponds or lakes where intermediate hosts reside. That's it for your heterophyes. And yes, this has been Gael saying, tara, akyat tayo.